Hi everyone, it's Dr. Jeff Harris here. I hope you guys are having a fantastic summer. I know that the weather's been fantastic and we've really been enjoying it. I've had a question that keeps coming up with us a lot today is that people keep asking me, so like, why do you see so many young babies in your office? You know, I see like 2-week-old babies all the way to 4-week-old babies to, 2 months. And I probably say the number one reason that we see so many babies in our office is because of breastfeeding difficulties. And the biggest thing when we start to look at breastfeeding difficulties, and if you're starting to have trouble with breastfeeding where you're having trouble with your latch or it's a painful latch, whether you're not getting that suckle reflex or you're not getting the proper swallowing, or you feel that your baby's very stiff or that they prefer to feed on one side versus the other, one of the biggest things that we relay back is how the birth process affected it. Because if you look back in your birth process, the more the length of the labor, the more traumatic that the birth process was, and especially if you add in things like forceps or acyclical births or breech presentation, breech during pregnancy, it really adds up into that trauma and it starts to cause stress on our newborns' babies. And that stress leads to them to be as stiff, not be able to turn their head as much. And the number one area that we always check on newborns is the upper cervical vertebrae. So it's right here. It's just below the top of the hard bone. You can feel it below your ear. If you slide down to that soft spot, that's called your atlas vertebrae. And that vertebrae connects to the lungs, it connects to the heart, it connects to all your organ systems. It's responsible for the digestive system, so it can relate to problems with colic or digestive problems or constipation, but it also controls the coordination of the swallowing reflex. The way we really check to see if that upper cervical has been impacted is we do a very quick exam and to check to find out how well it's moving, but we use thermographic imaging to look for unwanted inflammation on the top of the spine all the way through down there. Lactation consultants are amazing to help with breastfeeding, but we found with our patients, and especially patients that have had a tongue or a lip tie to have that procedure done, that the work in combination as part of the team, the chiropractic adjustment has been by far the most effective, and we're finding 90% of our patients that if we can help, once these babies start getting adjusted, just within a few adjustments start having amazing changes. If you want more information, if you want to hear my personal story, check out our blog. I'll post that information below. And otherwise, if you have any more questions, please feel free to contact us anytime. It's Dr. Jeff Harris. I'm in London, Ontario. Our phone number is 519-641-5995. Talk to you soon.